Thank you for joining us for the second annual Global Summit, Global Kidney Innovations, Expanding Patient Choices and Outcomes, a collaborative partnership event presented by the American Association of Kidney Patients and the George Washington University School of Medicine and Health Sciences. I am Ed Hickey, an attorney and Marine Corps veteran. I've managed kidney disease for 5 years as a chronic kidney disease patient and also as a caregiver. I'm honored to serve as AAKP Secretary and a member of the Board of Directors of AAKP, as well as the chair of the Veterans Health Initiative. It's my privilege to serve alongside such dedicated individuals who advocate on behalf of patients' interests, both within the executive branch and up on Capitol Hill. Today, I'm pleased to introduce Melissa West, Acting Vice President of Research, Discovery, and Innovation for the Kidney Health Initiative with the American Society of Nephrology, who will present on coronavirus, America's largest kidney innovation collaborative response. Ms. West.
Thank you to AAKP and GW for inviting me to participate in today's event. My name is Melissa West, and I'm the Acting Vice President of Research, Discovery, and Innovation. I have no disclosures outside of my employer for today's presentation. I'll be talking today about coronavirus and America's largest kidney innovation collaborative and their response. But to start us off with COVID-19 and really understanding how the coronavirus disease is its nomenclature, I thought I would just start at the basics. So this slide just really outlines, for those of you who this may be new information, really how the disease came to be named. CO for the corona, the I for the virus, D for disease, and 19 for 2019. I wanted to share this information, which I thought was very interesting for me, just thinking about how contagious coronavirus is. And I encourage all of you to access this article and to really get into understanding how we define the contagious nature of this virus. What is depicted on the right is the coronavirus as it relates to other illnesses, including influenza, and how often an individual, which is the box in the yellow in the center, could share the disease. And again, as we think through whether the impact of coronavirus, I think it's important that we all understand our role in containing this illness. We all have heard about the mortality rates related to this disease. And again, I wanted to make sure just to share with all of you some of the data that we have access to in terms of really where coronavirus sits as it relates to other illnesses, including influenza and pandemic. So the mortality rate within COVID-19 is 2 to 3%, but influenza is 0.1, but there have been other illnesses in the past like SARS and MERS who have had a higher mortality rate. What I think is fascinating and something that we should all be paying attention to is really not just the mortality rate or how contagious it is, but how widespread. And I think we should all be remembering and think through the impact of the disease, where if it was contained in one area of the world, we would be thinking a little differently about our reaction or our response to it. And so this really shows us, and again, this is older data from June 28th, really the impact across the world. Again, information that I'm sure you all have access to and have seen. Looking at older data, slightly older data of June 28th, this is focusing much into the United States. Obviously, some of these, the shading as it relates to the impact of coronavirus in our country could have changed in the time since I pulled this data. But I think what we're showing again here is that really, as you think back from March 31st, when we initially pulled data around the impact, we had only just under 200,000 cases, and now we have 2.5 million cases. And again, the number of deaths have significantly increased. So the impact of coronavirus, obviously, in our country is important. And as I transition here into the next portion of this presentation, I really want to highlight kind of ASN's role in disaster relief, because I think it leads us back to why we are responding in the way that we are. So ASN as an organization first entered into the disaster release in 2010 as we were trying to help out in Haiti with the earthquake. And so we were asked to participate with other organizations, including the government, to think through how we would help people living with kidney failure, in particular, deal with the disaster that was happening. This work continued into 2017 and actually grew as we partnered with new organizations in the Virgin Islands to think about how we would help as it relates to the hurricanes that were taking place in 2017. And so ASN was approached by ISN's Disaster Relief Task Force and FMC to help, in particular on one of the islands, really think through how they would be able to provide care to the dialysis community. 1 month later, what we were brought back into thinking about disaster relief in Puerto Rico, and we all know kind of the impact that Hurricane Maria had on the community. And again, once again, we were called upon to help with other organizations to think through how we would manage providing dialysis treatment to those with kidney failure. So this was the effort, the disaster relief activities that ASN participated in from 2010 to 2017 was a collective effort of a number of different organizations. And so as we transition back to talking about coronavirus, I think the same parallels kind of take place. What was different in terms of 2020 and the ability for our community to respond to coronavirus was the awareness that we gained through a number of the national media networks. AAKP was instrumental, as well as many of the other organizations, including ours, in making sure that we really were able to communicate what the impact of coronavirus was on our patient population, on all of you. And so through the Washington Post, the New York Times, through the news channels, what we were seeing as coronavirus was taking a hold in our country was the significant impact and the vulnerability that our patient community have. And this may be not just for those that are experiencing dialysis or who have been a part of dialysis treatments even at home, but this is also related to those who didn't realize that they had kidney failure and now all of a sudden were having a significant impact by COVID, but also for those that were having an experience AKI. And so what was different in terms of our trajectory through the last couple of months was that the community, and there was a higher level of public awareness that was taking place across multimedia channels that I think is really important. And so for me, as I sat awake at night in my role at ASN, thinking about research, discovery, and innovation, I'm looking at patterns, right? I'm seeing how multiple emergency disaster relief efforts have impacted our community. Now, here we are in the middle of COVID-19, obviously worried about my own family and my own circles, but thinking that there has to be more that we can be doing to avoid the scenarios that we've been in kidney disease in the past and the future. And so as I think about what our role is in innovating, I'm thinking about, what should we be doing differently to make sure that we handle future emergency situations. And so these were the things that were keeping me up at night. So what I'd like to do is now explain kind of the role that I play and the role of our organization plays in the kidney community to help you understand the response that we activated as a part of COVID-19. So the Kidney Health Initiative is a public-private partnership between the American Society of Nephrology and the government, specifically the Food and Drug Administration. It's been around since 2012, and our mission is really to catalyze innovation in the development of safe and effective patient-centered therapies for people living with kidney disease. This is the largest consortium in kidney disease, made up of over 100 organizations who are all looking to innovate, who are all looking to drive innovation and develop safe and patient-centered therapies, safe and effective patient-centered therapies. Our member organizations represent both patient organizations such as AAKP, but also the research institutes and the healthcare professional organizations. We also have members within the Kidney Health Initiative of industries, that may be device manufacturers or dialysis providers or pharmaceutical companies, and with the ability to work pre-competitively and work in a safe space where all companies and organizations can participate, we really work to drive innovation. Our main partners, as I mentioned, are the Food and Drug Administration, but we also have collaborations with NIH, CDC, and CMS. So we really try to work across the span of product development in order to think through how can we innovate, how can we find opportunities, how can we streamline, and how can we collaborate. What's integral and so important in the work that we do are the patients and the families. And so the Kidney Health Initiative not only works with the patient organizations such as AAKP, but we work with the individuals, because the individual patient voice is as important as the collective voice in all of the work that we do. And so these are individuals who represent all of you. They have a diverse set of background. Some of them have experienced dialysis in-center or home or PD. Others have had transplantations. Some serve as care partners. And they are continuing to advocate for the voice of the patient as we think through product development. And so when we were going through our time related to COVID, these were the individuals who were speaking up on behalf of all of you. AHI's work really focuses, as I mentioned, in that area of catalyzing innovations. And so we often put together white papers or documents or roadmaps to collect the evidence to support the future generation that would create the opportunity for new drugs or devices. So in a historical sense, kind of our work has really been more academically focused. Even if we do have patients at the table, we often are speaking mostly to industry and or to the researchers who are driving this innovation. So as I go back to thinking about kind of COVID-19 and really what was our role and when we were caused to really pause and recognize that our opportunity was not going to be in thinking through the clinical crisis. So where do we need dialysate? Where do we need patients to be thinking through their infection prevention strategies? How are the dialysis organizations thinking through how to triage patients appropriately? Really, for our organization and on behalf of for all of you, we were thinking through how we can respond and really elevate the need to make sure that we are not in this situation in the future. And so for us, and using the platform that we have, we focused in on not just starting with thinking through what we could do in terms of statements, and then we were working through over the next couple months really the tactics that kind of go behind it. So the first area that became very apparent for us within our consortium and our collaborative was to think through the technology development that would allow more patients, if they choose, more patients with kidney failure to be able to do so at home. Again, as you think back into the work that ASN has done in 2010 and 2013, whether it's related to earthquakes or hurricanes, the technology that would allow people to be able to consider dialyzing at their home during those times, or if they had to evacuate, also thinking through how they could take their technology with them versus being tied to an in-center dialysis unit. And so we wanted to make sure that we came out quickly with statements or advocating to think through how we can have research dollars, investment dollars, to really be able to drive the technology that would allow more patients more choice. And so our first effort was in this area. For many patients, dialysis hasn't really changed over 50 years. This is the same dialysis that our grandparents may have had experienced in 1965. And so as we think through the future, we really want to think through what becomes reasonable. The state of dialysis technology now has more opportunities for home. But really in the future, we want to drive towards technology that allows patients to be on the move, to not necessarily need the access to water, to be able to be a little bit more flexible in their choice. Now, again, as you think through the technology opportunities in the future, patients may still choose on a day-to-day basis to be in the environment that they are currently in to be able to do their dialysis. But if there was an impending hurricane, if we were right just after an earthquake, or in the time of coronavirus or another virus, being able to have flexibility and changing your modality in order to make sure that you can distance yourself socially would be a nice option for many patients to consider, and or the government or your clinicians. So we want to drive that technology development. The next area that we focused in on as we were trying to think about, again, how do we innovate? How do we think about making sure that our patient populations, those with kidney disease, are safe, is thinking about making the case for your inclusion in these COVID-19 trials. Often clinical trials exclude kidney disease patients for a number of reasons. And what we wanted to make sure of is that if there is a vaccine, or when there's a vaccine, I should say, or there's therapies, we wanted to make sure that we understood how they impact those with kidney failure and or those with reduced kidney function. And so the second area that we focused in on is this one where we are making the case to include individuals who want to in the COVID-19 clinical trials. This is an extremely important initiative. We are working closely with both our industry partners as well as the government to think through how to do this safely, how to make sure that patients know where their options are, and so that they can really engage with their physicians and make safe and effective decisions about whether or not participating in a COVID-19 vaccine or therapy trial is right for them. But again, what's most important from us is to think through, wherever we are 12 months from now, 15 months from now, 18 months from now, when there are tools in the toolkit that clinicians want to use, that we understand how those vaccines and other therapies act within people with kidney disease. Again, both early stage kidney disease as well as kidney failure. And this has been an important initiative that our organization has really championed and has gotten a lot of support for. The third and final area that we have identified as a need is to ensure the resiliency of clinical trials, kidney-specific clinical trials. So for those of you who may not know, there has been a huge investment in companies that want to innovate in the kidney disease space. There's lots of opportunity for them to be thinking about how they can bring forward new drugs and devices and biologics. And what's important is that we close that gap that may have been impacted by coronavirus and COVID-19 to make sure that investigators and sponsors can be innovative as they think through their current clinical trials that may be been impacted because of coronavirus, to make sure that we don't have a gap, whether you're an FSGS patient, an IgA patient, or whether you have another genetic disease, a rare disease, or maybe even if you have diabetic nephropathy, diabetic kidney disease, you know that the opportunities for future therapies are not impeded because of coronavirus. And so the third area that we're focusing really on is to make sure that there's resilience in both the clinical trials that are ongoing, but also the near-term clinical trials that will be starting up soon. This is an extremely important initiative if we really want to make sure that the future of your therapies are waiting for you when this coronavirus is all over. So I wanted to thank you for letting me participate, for letting me join all of you on this important initiative. I'm happy to take questions, or if anyone wants to contact me about any of the work that we're doing, my email address is included on the slide. Thank you again.
We appreciate Ms. West for her taking the time to share insights on collaborative efforts of medical innovation and how timely research and innovation can improve patients' lives and society.